is Miss Tosi. I'm gonna be your nurse practitioner for today. I already washed my hands. What's your name?
Shirley.
Okay, how old are you, Shirley? What's your date of birth?
July 8,
How old
1979.
are you?
43.
Okay. Why are you here today?
I have to do a complete physical exam for my job.
Okay. Do you know where are you?
Yes, LIU clinic.
Okay. What's today's date?
Today's May 1st, 2020.
Okay. Do you remember what you had for breakfast today?
I had eggs.
Okay. So I can see that you are alert and oriented times 3. Your speech is clear, coherence, and you maintain eye contact when you're talking to me. And also I'm gonna tell you 3 words and see if you remember them by the end of the assessment. Okay?
Okay.
Oh, so it's gonna be blue, it's gonna be chicken and pie.
Okay.
So this is what we're gonna eat: blue, chicken, and pie.
Okay.
Okay? All right. So moving along, I'm gonna give you this piece of paper. I would like you to draw. I'm gonna give you a pen with it. Can you please draw a clock with it to 7 p.m.? Okay. Brainstem is intact. Okay. All right, with that part of the exam out of the way, I already see you working here. I see your balance was steady, your gait steady, no abnormal gait. So I'm gonna go ahead and inspect your skin. Okay, I'm looking for any mass, any discoloration. I'm checking your upper lower extremity. I'm checking for cyanosis. I'm checking your nail for capillary refills. Okay, good capillary refill, good circulation. I don't see any obvious deformity. I'm checking your legs, all the skin. First inspecting them, I don't see any discoloration. You have normal hair distribution, which means that arterial circulation is good. I'm checking your capillary refill in your toes. Very good capillary refill. Can I check your palms? Your palms is pink. Very good and blanchable. Very good. So now that we finished with the skin assessment part and palpation, we're gonna move on to your head. Your head is normocephalic, atraumatic. I'm gonna go ahead and palpate your skull. Okay? The occipital area. I'm looking for any tenderness, any pain.
No.
No pain. I'm looking for mass. I'm looking for lump or bump. Okay? I'm gonna also check your hair. I'm gonna check the scalp as well. Scalp, no dryness, no infestation, pink, and the hair texture is coarse. Hair is well distributed throughout the head, no baldness, no alopecia. While we're there, I'm gonna go ahead and check your temporal artery. I'm checking for tenderness. Any pain?
No.
Okay, I'm checking for pulsation. +2, not bounding. So we check for that. I'm gonna go ahead and check for the sinuses. Okay. No, the maxillary sinuses. No issues with that. No tenderness. Okay, no tenderness. All right, no problem. So finishing with this part of the exam, I'm gonna go ahead and check for cranial nerve number 2. I'm gonna ask you to close one eye and to read the smallest line that you can read for me. And I'm gonna hold this 14 inches from your face.
LTFPH.
And you cover the other eyes, you're gonna read that same line backward.
HPFTL.
Okay, now you're gonna read it with both eyes.
LTFPH.
Your vision is 20/20. Okay. Sorry. We're gonna go ahead continue with our assessment where I'm gonna inspect the eye first before we go to the pupillary thing. We're gonna inspect the eyebrow. The eyebrow hair well distributed, evenly distributed, and they are symmetrical. And with that, we're gonna also inspect the face. Okay, the face is symmetrical. I'm looking for any bump, lump, any discoloration, no extra facial movement, uncoordinated facial movement. I'm looking at the eyelids, ptosis, eyelashes well distributed. I'm also gonna go ahead and use my hand to look at the sclera of the eye. It's white and no jaundice. I'm gonna look at pull down. I'm looking at the mediolateral canthus. I'm looking at the dark lacrimal dark patent. I'm looking at the conjunctiva. It's pink, moist, no crusting, no tenderness. Okay, so we're gonna go back and check for pupillary reflex. Okay, so before we do that, I'm gonna just checking the eyes for any foreign object. Okay, no foreign object. Pupillary reflex. The pupil constrict. Pupil constrict. We're gonna look for direct and indirect. I shine to the right and the left constrict. I shine again to the right and the right constrict. I shine to the right and the left constrict. I shine again to the right and the right constrict. Okay, so now while we doing cranial nerve number 2. That was cranial nerve number 2 that we, I think I mentioned that already. I'm sorry. All right, we're gonna go ahead to the we're gonna look for while checking the cranial nerve number 2, we're gonna check for your visual field. Tell me when you see my finger.
No.
Which finger is moving?
This one.
Okay. Show me where you see my finger.
No.
Which one is moving?
This one.
Okay, wonderful. So now that we check this cranial nerve 2, we're gonna go to the we're gonna check before we go to the fundoscopic part of the eye. Let's do the 6 cardinal gaze of view. We're gonna check for cranial nerve. Oh, you know, one more thing, I have to do the accommodation. I'm sorry. Convergence and accommodation. Okay, take a look at this pen. Okay, very good. I can see your eyes converge. No strabismus. Now strabismus. Now take a look at this and take a look at the wall. Take a look at this. Take a look at the wall. I can see your pupil dilate when you look at out far in the extremity, and it's constrict when you look at the thing. Okay. Oh, one more thing. When I check your face, I didn't see any hirsutism. Okay. Now that we finish with this, we can do the 6 cardinal gaze of view. Okay. We follow. I'm gonna make. You're gonna follow my finger. Don't move your head. Just move your eyes. Okay. All right. Okay. So that cranial nerve 3, 4, and 6 are intact. Extra muscles are intact. Okay. Now we're gonna move on to the fundoscopic part of the exam. So I'm gonna shine a light into your eyes and to check the inner structures of the eye. Okay. Okay. We're gonna put it to 0. All right. Okay, we're looking for the light reflex. I can see the light reflex. Now I'm gonna go in. I'm looking at all the structures. Okay, I'm gonna repeat to the other eyes. I'm sorry, I know it can be a little uncomfortable. All right. Gonna look for the red reflex. Gonna follow it in. And looking at the structure, the retinal artery. Okay, so for the fundoscopic testing, the retinal artery, there's no AV nicking, the optic disc is sharp, the macula, the fovea, visible, clear. I don't see no redness. Everything looks okay in your eyes. Okay. So now we're gonna move on. We're gonna move into the nose, where we're gonna first, can you occlude one nose, and breathe, okay? Okay, I can see that your nose is painted. Now I want you to close your eyes, and we're gonna close your eyes, and you're gonna smell for me. And this is, close your eyes and smell, and that's cranial nerve 1.
That's coffee.
That's coffee. Okay, that's cranial nerve 1. Very good. So both your nostrils are working, and cranial nerve 1 were also intact. After that, we're gonna palpate your nose. Okay, any tenderness?
No.
Okay, so we're gonna take a look at inside your nose. Okay. Okay. So we're gonna lift up We're gonna look in the nasal mucosa is pink. I don't see any drainage, no erythema, no polyps, no septal deviation, and the same on the other side, no septal deviation. So we're gonna go ahead and check for your ears. Actually, before I check for your ears, actually I'll do that. I'll do that after. Let's check for your ears. Let's check for your ears. Okay. Okay. Let me check your sinuses. I don't remember if I checked them already, but I'll check them again. Maxillary sinuses, no tenderness, right?
No tenderness.
No tenderness, no pressure, right?
Right.
Okay. So we're gonna check for your ears. We're gonna check cranial nerve number 8. Okay. I'm gonna ask you to close one ear, and I'm gonna whisper something. Tell me what I say.
Apple.
Okay. Close the other ear. Tell me what I say.
Apple.
Okay. So now I'm gonna ask you to. We're gonna move on with that test. We're gonna check for Weber test and Reiner. Okay. So I'm gonna strike this. You're gonna tell me when you don't hear it anymore. Actually, we'll do Weber first. Okay. Sorry. Okay. Do you feel it in both?
I hear it in both ears.
Oh, okay, wonderful. Now we're gonna check for Reiner. Tell me when you don't feel it, hear it anymore. Wait, sorry.
Now. 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 Now.
Okay, so for the no lateralization with the Weber test, and for the Reiner, there's no sensory hearing loss, and air conduction is greater than bone conduction. So now we're gonna go ahead and we'll inspect the ear. The ear is symmetrical. Now we're gonna palpate the auricle. Any pain and tenderness?
No pain, no tenderness.
The yes, any trachmas, any pain or tenderness?
No.
The mastoid process, any pain or tenderness?
No.
We're gonna inspect behind the ear. Okay, so now we're gonna take a look inside the ear. Okay, so I'm gonna pull back and up. I'm looking at the ear canal. The ear canal is pink, no erythema, no suramen, no redness, and I'm looking at the tympanic membrane, no scarring, no perforation. It's pearly gray, cone of light at 6 p.m. So we're gonna repeat the same test to the other side. Ear canal is pink, no erythema, no mass, no lesions, no redness, and no suramen. And then the tympanic membrane is intact, no scarring, no perforation. Cone of light is at 4 p.m. Okay. Okay. So before we go to the other cranial nerve, we're gonna go back to test for cranial nerve number 5 and cranial nerve number 5 and cranial nerve number 7. Okay. So cranial nerve number 5, we're gonna test for 2 things. Okay. So we're gonna check for. Can you bite your teeth? We're checking for the mesenteric muscle. Okay, can you clench your teeth here? I can feel the tympanic muscle. Very good. Now I'm gonna check for can you move your chin against my hand? Okay, very good. Now close your eyes for me, please. You're gonna tell me if you feel something dull or sharp or smooth. Okay, close your eyes for me, please.
Soft, 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 soft.
Very good, thank you. Now we're gonna go ahead and assess for we're gonna go for the before we move to that to cranial nerve number 7, let's check for corneal reflex. Okay, good corneal reflex. Now corneal reflex. So now we're gonna go ahead and We're gonna check for cranial nerve number 7. I need you to smile for me. Can you puff out your cheeks? Can you frown? Okay, can you raise your eyebrow? Okay, can you close your eyes? Don't let me open it. Very good. So now that we check cranial nerve 5 and 7, we're gonna move on into cranial nerve number 11. Okay, so with cranial nerve number 11, can you move against? Good, thank you. Move against. Good, thank you. And raise. Okay, good. Cranial nerve 11 is intact. Now that we finished with that, we're gonna check for cranial nerve number 8. We're gonna check your mouth. We're gonna check for cranial, not 8, sorry. We're gonna check for cranial nerve number 9, 10, and also 12. Okay. Now, to do that, we're gonna start with inspecting the lips. The lips is moist, pink, no sores, no hepatic lesions. We're gonna go ahead and open the mouth for me, please. We have good dentition, no retracted gum line. We're gonna check the long tongue. The tongue is pink, it is symmetrical. We're gonna check under the tongue. Under the tongue, we're looking at the mandibular and submandibular ducts. They look patent. Now we're gonna, can you say, hold on a second. Can you say for me, please? Very good. I'll check this and then I'll describe what I saw. Okay. Okay. Very good. So we have positive good reflex. One other thing is that when we look at the uvula. It was midline. I look at your tonsil. Uvula was mandled and hard and soft palate, raised and down. Raised and fall. So, and also the tonsilla, it was pinkish. It was not red. There was no erythema there. There was no drainage, no exudate. It was a 2+, less than 25% of the pharyngeal space. Okay, now we're gonna move on to the next step of the physical exam. We're gonna go ahead and inspect the neck. All right, we're gonna inspect the neck. I'm looking for symmetry. Neck is supple. And I'm gonna look at for the trachea. The trachea is midline, no tracheal deviation. Now I'm gonna, I'll do it after. I'll go back after to the cranial nerve number 12. Trachea is midline, and then we have. I'm gonna go ahead. Can you swallow for me so I can identify the? Very good. So now I'm gonna go back and checking for the thyroid for symmetry. Thyroid is symmetry. Any tenderness?
No.
Okay, and then there's no nodule. So I check for the thyroid is symmetry bilaterally. It's symmetrical and there's no goiter, no nodules. I'm gonna palpate, but before that I forgot to ask you to do something. Can you stick your tongue out for me, please? Can you move it up and down, side to side? Okay, cranial nerve number 12 is good. And also they also check for sensory and the cranial different part of the tongue for cranial nerve number 12 as well. So now we're gonna move on to palpate your nodes. Okay, I'm gonna stand behind you to do that. Okay, we're gonna palpate for the pre-auricular, post-auricular. We're gonna palpate for the occipital. We're gonna tonsillar, submandibular, and submental. We're gonna do superficial cervical chin, and then posterior cervical chin, and then can you move your head to the side? Deep cervical chin, shin. Okay, now we're gonna check for the supracervicular nodes. Okay, so I didn't feel any big nodule that will indicate if there's an inflammation or something going on, infectious process going on. Now that we did that, I'm gonna inspect the back of your neck. All right, I'm gonna check the cervical spine. Okay. Okay, it's alignment. I don't see any cervical displacement, no scaphosis. Now, I need you to, I'm gonna go ahead and move on to, before I go to the respiratory I wanted to finish with the neurological part of the test, okay? So we're gonna ask you to get up from the chair. I'm gonna check your balance again. Can you walk toward me? I'm gonna check your gait again. Walk toward me normally. Okay, you can stand here. Now I want you to walk toward me, heel to toe. Very, very good. Now I need you to go back, but walking on your tippy toe only. Okay, very good. Now I want you to walk toward back to me on your heel. Okay, so now I need you to strap your right heel up and down your shin, and you're gonna repeat that to the other feet. Very good. Now while we're here, I'm gonna have you stand here. Don't worry, we're not gonna fall. Okay, I want your feet together, hand to the side. Now I need you to close your eyes. I'm gonna count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 15. Now I need you to put your hand and supination forward. Keep your eyes closed. I'm gonna count for. Don't worry, I'm holding you. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 15. Very good. Now that we finished with this part of the test, we're gonna do the rapid hands movement, coordination hand movement, looking for coordination and brainstem function. All right, very good. Yes, and then you're gonna go like this, and back, rapid, and a rhythmic movement. Very good. Brainstem is intact. While we're here, I'm also gonna check for the sensory, and before we're moving up. Okay. All right. Okay. I'm checking for sensory and upper and lower extremities. Okay. All right. Thank you so much. All right. Now you're gonna tell me if it's dull, sharp, dull, sharp, or vibration. Okay.
Soft. Soft. Dull. 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 Sharp. Sharp. Vibration. 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 Vibration.
Keep your eyes closed for me. I'm still gonna check for the. Now you tell me, what do you feel?
Cold. 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 Cold.
Okay. Now keep your eyes closed for me. I'm gonna place something in your hand. You tell me what it is.
It's a key.
Very good. All right. So now we're gonna go ahead and go to the respiratory part. I'm gonna check your lungs. First, I'm gonna do the front. I'm gonna inspect your chest. AP, okay. AP to lateral ratio is 2 to 1, which is normal. And then we're gonna inspect the chest for any excursion, any retraction. I'm looking for mass. I'm looking for any discoloration. Your respiratory movement look symmetrical, not too rapid, not too fast. It looks regular. Now we're gonna go ahead and palpate. Okay, and palpate for any masses, protrusion. Okay. All right. After I palpate, I'm gonna go ahead and percuss. Sorry. Okay. Very good. Now, while it's open, your chest is open, I'm gonna go ahead and listen. Every time you feel my stethoscope, take a deep breath. Okay. We're gonna listen for a full breath. Okay, very good. Now, for the frontal part, no adventitious sound. We have vesicular lung sound to the front. I'm gonna cover your front for privacy. Drape your front. Now I'm gonna go back to check your back. Okay. I'm gonna put it on the other side because I can see you. All right. So first we're gonna inspect the back. We're gonna inspect for any abnormal, obvious deformities. We're gonna check for any mass, any nodule. We don't see any. So we're gonna go ahead and palpate. Any tenderness?
No.
I don't see no mass. No movable mass. Okay, no tenderness. So now we're gonna go ahead and percus all along all the fields. Take a deep breath. Okay, now we're gonna look for that. I'm gonna look for diaphragmatic excursion. Take a deep breath for me. Okay, and I'm gonna percus for lung expansion. Oh, you have symmetrical lung expansion. Sorry, we're checking for lung expansion. Go take a deep breath. Symmetrical lung expansion. I'm gonna check the front too for lung expansion. Sorry. Take a deep breath. It's symmetry. Now we're gonna look for diaphragmatic excursion. We're just gonna do it on one side. Take a deep breath and hold it, please. Take a deep breath and hold it. Okay. All right. Now I need you to take a couple of regular breaths and then expire it and just stay in that relaxed position for me. Okay. This is the level. It's about 5 centimeters. So diaphragmatic excursion is normal. Now we're gonna go ahead to the auscultatory part of the test, where we listen. First, we're gonna listen to the lung sounds in the back. Deep breath. We listen for a full breath. Okay. Now I need you, I'm gonna check for firmities. I need you to say 99 for me.
99, 99, 99, 99, 99.
Okay, I feel resonance, which is very good, no consolidation. Now I'm gonna listen. Okay, can you say E for me, please?
E,
Okay, that was egophony. We check for egophony. I heard E, no A, so there's no consolidation. Now we're gonna check for whisper pictoriloquy. Can you say 99? Whispers 99. Okay, no muffled sounds heard. We barely hear it, so that's good. There's no consolidation. So now this is our respiratory part of the test. Now we're gonna go to the cardiac part of the test, and the first part of the cardiac, we're gonna check for. We already checked for the pulse. We also check for the we also check for the pulse deficit, and also take the measure the blood pressure. Her blood pressure is 120/70, which is normal. Which is normal for you. That's normal for you. Which is a normal blood pressure. Okay. So now we're gonna go ahead and inspect. Actually, first we're gonna look for our location. We're gonna try to combine them actually to see. We're gonna combine them. We're gonna say the location. We're gonna also listen as we say the location. Okay. This is the second intercostal space. This is the aortic valve. We're gonna listen. Take a deep breath. Very good. Hold it. And then we have the second intercostal space, left clavicular line. Deep breath. Okay. We're gonna go to fourth intercostal, left clavicular line. Take a deep breath. This is the tricuspid valve. Okay. we're gonna go to the fifth intercostal mid axillary line for the mitral valve. Okay, and also the apex of the heart. We're also gonna check for the point of maximum. We're gonna listen to impulses. Okay, it's slightly palpable. Now we're gonna palpate for any trill or buoy. Okay. Okay, no heaves and no, sorry, palpate for any heaves and trill. So there's none. All right, so now I'm gonna ask you to lay down at a 30 degree where we're gonna check for jugular vein distension. So I'm gonna lift the legs for you. Okay. Okay. So I'm looking, there's no jugular vein distension from my observation here, but I can see the pulsation here where I'm gonna measure. Okay, it's here. The pulsation is right here. My ruler is here. Okay, it's 2 centimeter, which is very good. And I'm gonna also, while I'm here, inspect for carotid pulse. Okay. Okay. All right. I'm gonna inspect the other side too. Okay. All right. Now I'm gonna palpate the carotid one at a time. Okay. Okay. And there's no buoy, and there's no buoy. Now the carotid pulse have good uptake and 2+. Now I'm gonna go ahead and drip you down a little bit. So we're gonna listen to the heart sound. Again, by the way, when we listen to the heart sound, we're doing it with both the diaphragm and also with the bell. Okay? So we're gonna go ahead and listen to the aortic valve, diaphragm and bell, pulmonic valve, diaphragm and bell, and then tricuspid valve, fourth intercostal, diaphragm and bell. Okay, mitral valve, diaphragm, midline, diaphragm and bell. Okay, so there's no S3, no S4. I'm gonna go ahead, sorry, and palpate them while you're laying down. I'm sorry, okay? That I'm still have to palpate them for heave and trill. Okay, no heaves and trill, okay? Now that we did the heart, now we're gonna go ahead and check the aortic artery. Okay, I'm gonna go ahead and drip you. No, don't worry, I'm gonna cover you for privacy. Okay, all right, thank you. Gonna inspect for any movement, and then no, we're gonna listen first. Sorry, we're gonna listen for the abdominal aorta. Now we're gonna listen for renal artery. We're gonna listen for iliac. And then listen for femoral. We're looking for buoy. Sorry. Let's believe that it's on the skin. I don't. Okay. All right. Now, you can sit up for me, please. Okay, so now we're gonna continue with the vascular part of the test. We're gonna check your lower and upper extremities. We're looking for any discolorations, all right, any edema, any fluid retention. I don't see anything, and your legs are not pale. Looking at your arm, you get normal hair distribution for both of them. Also, not pale, and of course we check the nail already. They are blanchable. No pitting edema. When we check at the ankles, the legs, okay, no fluid retention on the arm, no swelling. Now that we do that, we're gonna check for your pulses. Okay, we're gonna check for your brachial pulse for a full minute. We're gonna go check for your radial pulse for a full minute, and we're gonna check for your pedal pulse first for a full minute, pedal pulse for a full minute, and then for your posterior pulse for a full minute. Okay, all right, all your pulses are equal. They +2. Your nails are blanchable. Okay, good circulation to the feet. We did check the dorsalis pedis, we checked the back, and we check nothing. All right, so now we're gonna go ahead and close. All right, what did we, okay, so we checked it. We're gonna go ahead and go to the abdominal part of the test. All right, we're gonna still keep the dripping. We're gonna start by inspecting your abdomen. Okay, we're gonna inspect the abdomen. We're inspecting for rounding. We're looking for shape. We're looking for masses. Of course, abdominal aorta palpation, palpation, which we didn't see. After we inspect the abdomen, we're gonna auscultate. We're gonna auscultate, moving in a clockwise position. We auscultate in all 4 quadrants, and patient have positive bowel sound of 10. Normal is 5 to 30, which is normal. Now we're gonna percute all 4 quadrants. Okay, tympanic sound is heard throughout in all 4 quadrants. Now we're gonna percute for liver span. Okay, now can you take a deep breath and hold it for me, please? Okay, liver span, I mark it is like 7 centimeter. Now we're gonna percute for the spleen. So no dullness, which means like the spleen is not, there's no swelling, there's no splenomegaly. Now we're gonna check for liver border. How we're gonna check for liver border? We're gonna palpate. We're gonna start the palpation. We're gonna start with light palpation first, and then we go to deep palpation. Okay, we're gonna go deep. We're gonna check for deep palpation first. Any pain, any tenderness?
No.
Pain, tenderness?
No.
No. Okay, I'm checking for liver span. Take a deep breath for me. Okay, I don't feel the liver. Okay. When we inspect the abdomen, I had seen a good, well healing scars. Did you have any surgery?
Yes.
Okay, very good. Now we're gonna also palpate the inguinal node. No nodule noted. Okay. Okay. You can sit up for me, please. All right. So now we're gonna go ahead and check for your muscle strength. And while we're doing that, we're gonna do range of motion. And while we're doing that, we're gonna check for muscle strength, range of motions, and palpation. Okay. First, we're gonna check for the TMJ joint. Can you open and close your mouth for me, please? Okay. So this is no clicking. I didn't feel any clicking, any popping. Now, can you move your head to the side? Good muscle strength. Plus 5 out of 5. Very good. Now, can you push? Oh, can you pull forward? Okay. Can you pull backward? Good muscle strength. Now we're gonna check for your shoulders. We're gonna palpate first. Okay, no tenderness. Okay, the shoulders is asymmetrical. Now I'm gonna do the range of motion of the shoulders. Can you put your head up, left hand up all the way, and then all the way to your back? Okay, can you brace yourself up and then cross it down? Very good. Now can you scratch your neck? Can you reach for the opposite scapula? Scratch your neck with the other hand, reach for opposite scapula. There's no sign of rotated cough. The patient have good range of motion and no signs of tendinitis. We're gonna check for your elbow. Okay, we're inspecting. There's no swelling, no deformity. No swelling, no deformity. I'm checking for the olecranon. I'm moving the crepitus. Okay, checking for the olecranon. No crepitus there. Okay. Now we're gonna check for range of motion of the wrist. Okay, can you flex? Can you extend for me? Can you pull it? Can you supine it? Okay. Now, very good. Now we're gonna move on to your wrist. We're gonna look at your wrist. Okay. No deformity. We're gonna palpate. No tenderness. Okay. All right. No crepitus. No tenderness. I need you to flex. Okay. Extend. Okay. Ulnar extension. We do extension. Okay. Very good. Now that we check the wrist and the wrist range of motion for the wrist is good. We're gonna check for the fingers. We're gonna check for metatarsal phalanges and we're gonna check for metatarsal. We're gonna check the metatarsal, the PIP and the distal, the DIPs. No thing. Can you go like this for me? Okay. Good. Can you go like spread them and close them? Okay, very good. Now can you go like this? Okay, you did that already. Very good. So now we're gonna check for your hip. Quickly, can you get up for me, please?
Yes. Sorry.
Can you bend down for me, please?
Yes.
I'm checking for. Okay, very good. Now can you go back and sit down on the chair for me? Okay. We did that already. Just sit down and check this. I know this. Check this one already. I forgot to check the hip. Now, I'm checking for your hip flexion. You can you lift your feet for me? Okay, lift this one. Can you adduct? Can you adduct? Cross one over the other. Very good. Now, we're gonna check for your knee. Inspect the knee, capillary. Okay. Can you lift it up for me? Okay. Can you lift up? Okay. Now, for your ankle, palpate. Can you and flex? Okay. Internal inversion, exversion. Okay, very good. Now, I'm checking for your fingers. I mean, for your toes. I'm looking for the metacarpal, DIP, PIPs. Okay, can you spread them out for me? And then can you close? Okay, you have good range of motion and all this for extremities. Now I'm gonna go ahead and check for Babinski sign while you're here before I check the tendons, because I don't. All right. Okay, good reflex. Okay, good reflex. Now you're gonna sit up. I'm gonna check for tendon reflex. Okay. Okay. All right. Okay. Okay. Okay, we're gonna do the same here. We're gonna do this part. Oh, sorry, I hit you hard. Sorry. Okay. Okay, we're gonna do the same for your knee. Okay. Okay, and we're gonna check for, okay. Okay. All right, that concluded our physical assessment for today. Thank you.
3.